Time is 9:32 now, and for years we've been told red wine is good for our hearts. But some cardiologists are rethinking that. And the Fox Medical team's Beth Galvin is here now to talk about why. And I think there's like a collective just, really? What's going on with this?
Don't hate me, Elise.
You're just the messenger.
No, what I will not tell you is that, cardiologists are saying that you have to give up drinking red wine. You can still have your red wine, but what they're saying is, we had this major study that came out just last month that said no amount of alcohol is considered safe when it comes to our health. It all has risks. But one cardiologist says he's really not convinced that the so-called benefits of drinking red wine outweigh those risks.
For decades, we've followed the lead of the French, believing that nightly glass or two of Merlot or Pinot Noir was okay to drink because red wine helps protect our hearts, right? Maybe not, says the cardiovascular group's Dr. Salil Patel. Lately, Patel's been telling his patients that he and other cardiologists have had a change of heart about recommending red wine because he says there's no real evidence it can boost our heart health.
And I'll tell them, we used to think this, and we realized that was not correct. And our learning has changed.
Dr. Patel says scientists used to hypothesize that drinking red wine was the reason Europeans, especially the French, have lower levels of cardiovascular disease than Americans. But he says the science just isn't that simple.
And it may not be the alcohol that's actually protecting them. Americans tend to drive more compared to European folks. We tend to exercise less. Our rates of obesity are higher.
So if you really want to keep your heart healthy, Dr. Patel says make sure that you're getting enough sleep and try to eat a mostly plant-based diet and get out and get moving for at least 30 minutes a day on most days. And if you enjoy your red wine, he says that's okay. But he recommends limiting yourself to 1 glass a day for women, 2 for men.
If you want to have a glass of wine, realizing that there may be a risk to it, but you find it to be enjoyable, that's okay. That is a conscious decision. But it shouldn't be done with the intention of improving your health. You have to be honest with yourself. If you're going to have this glass of wine, it's because you enjoy that glass.
And red wine does contain some heart-healthy ingredients like antioxidants, but so do blueberries. They don't have that much risk that I know of. So Dr. Patel really recommends tweaking your diet, getting active, working with your doctor to stay on top of your health. He says those are really the known risk factors that we have, eating a fatty diet, not exercising, those kind of things. We can make those changes. He's not really convinced that drinking a lot of red wine is gonna, don't laugh at me.
It makes sense.
I know you don't like this story.
It does.
Yes.
Well, but it's good to know it is. So is red wine healthier than other types of alcohol, like maybe beer or liquor?
So it might be for some people because red wine is the kind of beverage that people tend to sip and savor and have maybe 1 glass or 2 at a time. It's not necessarily, when you stack it up, a whole lot healthier than other forms of alcohol.
Okay, so what you're saying is don't down a whole bottle and think to yourself, this is good for my heart. I'm doing this for my health, right? Like that's
cheers. It's good for my heart. Yes.
Yeah, not the idea here.
Yeah.
All right, Beth, thank you.